So I invite you to stay at the table, and we'll now invite Emmanuel Macron to come begin the closing session. Hello, everyone. I feel like I'm turning my back to a lot of people, but I think it's inevitable in this room. I was very interested in this debate, and I thought that you had converging ideas, so that I think that we can come together on a lot of ideas on the important topics that you've addressed. I wanted to be present here with you today. Last year, I was here present by video conference. We talked about digital aspects and new technologies, and I committed to coming here this year, and here I am. It's a bit intimidating because I'm in this pit where all of the participants are more familiar with the topic than I am. So I'm here in a very humble position, but I wanted to share some ideas with you. As Xavier Bertrand is right, as he said in his conclusion, the topic that you're talking about each year, that we're talking about now, is a very vital one for our citizens in their daily lives. More than many other topics that we spend a lot of time on, it's a fundamental discussion for hundreds of thousands of French people who are not just involved as professionals, but as patients, but as health professionals. It's very important for the appeal of our country. It's a topic of competitiveness, and it's not just a question of health and health care. It's actually an economic sector, and many of you are representatives of this economic sector. And it's the possibility for the public and private sectors to collaborate. So health has to be at the heart of the debate of the day. I'd like to start with two paradoxes to begin with that strike the less experienced person that I am compared with you. We have a healthcare system that is extremely competitive, that is a high-level system with very well-trained professionals. The Debré model worked and has blossomed with results that are quite good, better than many of our competitors when we look around us. Of course, we can perfect it, and it's long-term work that has led to the results where we're better managing things now, but at the same time, we have academic and scientific excellence. We have innovation in our country. And alongside that remarkable healthcare system recognized by all, we have a health system that is failing, that has the shortcomings. This morning before I came here, I was in the valley talking about air quality. It's amazing when we see the professionals, your colleagues, who are saying that we're asking children a few kilometers from here to not go and play in the schoolyard during their breaks. When I look at the health figures, I see we have one of the lowest vaccination rates in Europe. We're taking more medicine, antidepressants and others. We're looking at mortality that we could avoid, and our figures are not so good. They're actually increasing. Our life expectancy will go down in the coming years if we continue to neglect the questions of prevention of premature death. So there are strong and weak signals saying that our health system as a whole is suffering from some problems. And if we look at the OECD results, if we look at prevention, we're seeing that the problems are increasing. Everything that is not captured in the strict perimeter of the health care system tends to drift. So we're not so good on the prevention as like-minded countries or similar countries. So the system can be quite unjust with territorial, regional inequalities. If I talk about the figures, the premature births can triple from one region to the next. We talked about this with some of you at the end of the day yesterday. We know that inequalities exist throughout the line B of the RER in Paris, 2 years of life expectancy on this railway line for people who live in the same region, who have access to the same healthcare system. So there's something that's escaping the system that is creating this injustice. We have 3 times more obesity in the workers, blue-collar children, than the children of white-collar workers. There's also a problem with failure in the school system, and we find these inequalities in the territories. Also, they're not only due to the healthcare, but to the health system and the way we develop our regions, the access to primary care and to prevention. So these inequalities are difficult to bear, to understand. There will be different paths, and the end result will not always be the same. But maintaining these types of inequalities is not worthy of a project such as ours. And the French paradox, when we compare and we say that the health system has some failings, that's a problem that we need to address, and we need to start from there. The second paradox comes back to what you were saying in this last roundtable discussion. Many of you are much more familiar with this sector than I am, but I have tried in the last few years and in different roles to learn about this and work on this. In like many sectors, we know what we should be doing. We all agree on what we should be doing, and yet we can't do it. We can't achieve it. So there's a problem with collective decision-making or the coordination of the different actors. I think that this can impact our model, be it the healthcare system or the health system that was designed after the war, because the transformation that is underway is really causing us to rethink things, is challenging us. The system proved itself in the second half of the 20th century, but it was built for a population that was young, where the big cohort was the active population that caught illnesses that the doctors could cure. They were managed by professionals that built a new hospital system and a new private practice system after the Debray law. So this has really changed in the last decade, though. This whole situation, our population is aging. We know that in 2050, 1 out of every 3 French people will be above 60 years old. That was 1 in 5 a few years ago. This is a huge change for the patients that you'll be treating. Chronic diseases continue to develop, and this is really impacting the financial management of the health insurance system. And we know also that the big dilemma is not to know whether we cure or not, it's to know how we can accompany people with diseases for very long periods of times. Maybe we'll be able to cure them, but how will we reduce their suffering? By finding the right balance between management of the disease over time and their daily lives. The economic challenges have really changed with innovation that has accelerated and continues to accelerate, and the digital world is accelerating also in an extraordinary manner with the customization of healthcare and medicine. It's continuing to grow. It goes hand in hand with innovation. It's what our supply allows us to do.
And the coordination is still extremely centralized and state-driven. And then you have professionals today who are different from those yesterday. We have to bring this all together. Healthcare professionals today are not the same. The young generations, they don't want to be in medicine like those in the past. They don't want to be isolated. They don't want to bear the same weight, the same suffering. It's a new generation. So we're not just talking about the medical field here. Young people see the balance between personal life and professional life differently, and we're seeing this. So we're seeing the main facts. What is changing incrementally, and that's the challenge, that's the paradox. We're seeing these changes. They're on the horizon. We're seeing these transformations. They're coming in very fast from innovation, from transformations in demand, in medical behavior, and then collectively There's a lot of goodwill around the table and on the other side of the screen, but our approach is incremental. We're saying, okay, we've got to change things. Let's create funds so that there's more freedom for people in counties and regions. We've got to link things properly. We've got to articulate things properly. So it's like throwing a few €1,000 into an ocean. It's incremental. We've got to innovate, but it's difficult to coordinate with the objective for health insurance from a financial point of view. So there are local players who don't have enough money. There is remuneration that is based on the old regime. If I look at all of the challenges that I've talked about, especially the first paradox that I depicted, we need to look at things differently. We need to look at this complexity in objectives differently. We've got to take on board prevention and environment differently, and we've got to look at the services. But we're still having these debates where remuneration is based on acts because stakeholders have certain positions in the system. So to move away from these two paradoxes, healthcare and the disruption that we're seeing, the upheaval, the inability to move ahead, I think our collective duty, especially in times like these, where we are together and we're talking and thinking openly, I think we've got to move away from this incremental approach. We've got to say, okay, the solution is we've got to have reforms, but what about the policies in France? Do we just have to have reforms? We want to increase resources. It's better to pay professional acts better. That's the solution. We might say that. But it's about adjusting the curses in an existing system. But there's this constraint. We can no longer absorb the transformations underway. So the question is, how are we going to go about things? We've got some good performance in some areas, but how are we going to rethink all of this? We heard about the distrust of the state, distrust in relation to partners, so we need to find a framework for trust. Let me just share with you some of my convictions. The first is that we can't recreate trust in the system if we don't share the right kind of objective. What kind of healthcare system do we want collectively? We're not sure about the end goals. I think we want a system that is not just high-performing for healthcare, but high-performing in terms of healthcare objectives. We want to be able to guarantee for our citizens that they will be in good health. And it's not just a question of care. We want to reduce inequalities. At the same time, it seems to me, we want to build future professionals, private practitioners, structures, whether they are health centers, clinics, or hospitals. We want the right centers, the right establishments that are more flexible with abilities that can adapt to local realities. We want our system to integrate innovation more easily, to provide better health care, and we want a return on investment. So it's not about just fulfilling a promise. It's about having very different structures according to needs and according to regional organizations and populations. It's about being able to innovate and integrate innovation into our landscape. We have a problem in France. For the right reasons, from some points of view, we're blocking innovation because we're just looking at the short term and the budget. We want individualized medicine for everybody so that we can accompany transformations and take those into account fully. Once we've said this, it seems to me that the first road that we can explore is look at responsibility. In other words, move out of the face-to-face between the state and actors. I don't think that the solution is the state against regions. You can look at politicians, we've said it, that recreates other rigidities. The solution is centralization and local intelligence. Allow local stakeholders to get organized properly. Perhaps the regions, perhaps the regional health agencies with more flexibility, perhaps stakeholders among themselves. I was in Sallanches at the hospital. They've got a remarkable structure. As the hospital was too small and threatened, they opened up to public-private structures. They included nephrology into the private sector, and so they're managing beds better and home care better, monitoring of patients better. Private practitioners are working in the emergency wards, so it's a great example for the discussion underway. So it's to allow local organizations to do what is best for them. So to move away from this distrust, the solution to our problem is not in the state alone, rolling out its regional objectives or local objectives, although I don't believe in that because it will always arrive too late. It won't be able to follow innovation, and not the regions either, because they will be creating the same kind of rigid structures. They will be creating power structures. The key is that the healthcare community needs to be more responsible, needs to have a real autonomy in terms of resources. And if we want to solve the problem of inequalities in the healthcare field, this is one of the real avenues that needs to be explored. It's not a conventional approach for France, whereby we say we've got a single solution. I believe in the association of professionals, associations of elected officials, small and medium industries, and regional health authority structures with better autonomy. The second thing that is important, and it goes hand in hand with this idea of making people more responsible and accountable, is to look at the long term. Instead of just looking at the budgets that are managed on a yearly basis. The big transformations cannot be managed on a year-to-year basis. It's just not possible. Today, we have public expenditure objectives, and we're sticking to them. And that's great. A lot of progress has been made in this area. It really is the fruit of some collective work, trying out of practices. However, we're still looking at parameters when we do this, because year after year you're managing. So you can't rethink about the structure. The risk is too big. Stakeholders are not invited to do this. They're not encouraged to do this because you can't use what you've already deployed. You could do it for virtuous reasons, and I'm confident from that respect. But we don't want to. We want to look at real intelligent savings. This means that we need to invest heavily so that we can reorganize structures that close where it's not intelligent, invest in order to have a more comprehensive healthcare offer, and for innovation, I'll come back to that. The third subject that goes with this is to get rid of the silos. I mentioned this when I was giving the example of the Sallanches hospital today. We need to get rid of the silos, and we also need to train people so that they can manage the changes. The structures as they have been designed, the activities as they have been designed, if we look at things clinically, they still belong to a model that has not taken into account changes in terms of usage and technologies. So we need to get rid of partitions between professionals and structures. Now, is our system relevant when we see what it represents for communities? When we talk about doctors' training, for example, do we actually analyze doctors' time? What is the share of their time for administrative tasks? How much time do they use to carry out nursing tasks? What about specialists and their time? How much time do they spend providing specialized healthcare? The loss is huge. Now, sometimes this upsets local representatives because our conception of the practice is to say, okay, I'm going to manage everything to do with my relationship with the patient. This is not what we need anymore, I believe. We need to look at the kind of medicine that we're building, and we need to take into account patients' aspirations, and we need to take into account the happiness of our healthcare professionals. So we need to get rid of silos. There are new jobs emerging. Healthcare professionals who are trained will be moving towards jobs that will be emerging according to the needs. Doctors will coordinate medical systems, and personalized medicine will be different. And we need doctors who don't have the same relationship with patients. We can see this, but we also need to build on medical responsibility and practices, and things will be different. If we want to talk about healthcare, we need to think about the silos. What about people who are in education, healthcare education? What about people who look into loss of autonomy? We need to irrigate the other healthcare fields, and this breaking down of silos also involves administration and coordination. I think that annual management, year-by-year management, is not enough. We need something that takes into account several years ahead. We need to think about this irrigation. We need to move further afield and take into account other healthcare professionals. We won't be able to improve healthcare or set up prevention because we're just coordinating healthcare, and it's a kind of a closed world. So we need to get rid of the silos from an administrative point of view. We need to get rid of the silos for policies, so that we need to go about things more intelligently, and we need to apply what we're doing to regions, because getting rid of the silos goes hand in hand with this creation of more responsibility at regional level. And then innovation. We've talked about innovation. You have talked at length about it. It's one of the important themes of this event. Now, a few months ago, I was in charge of the digital economy. Innovation. We are subjected to innovation. Change takes place. Technological change involves shifts in paradigm. Innovation, whether it's technological, organizational, because you have organizational innovation everywhere, innovation is something that is transforming our landscape. And I think that when you have systems that develop antibodies to innovation, we are at risk. Today, our collective organization, for very good reasons, because there are end goals that have to be reached that are based on the short term, and in a known universe, there are many antibodies to innovation. They're encouraging local stakeholders to introduce organizational innovation. It's very difficult. There are many ramparts to this. And it's discouraging professionals to be involved in technological innovation, because this technological innovation, it has a price. And I heard you talk about telemedicine earlier on. It has a price. It has an organizational price. It has a price in terms of practices. But we were talking about this in the Chamonix Health Center. It also involves gains in terms of transport. When it's reliable, transport is reduced, but it has to be taken into account. There has to be a collective organization that takes on board this kind of innovation. Disruptive innovation, it takes 10 years for it to emerge. If we have a system that sets up barriers from the beginning, so right from the first clinical trial, or has waiting periods that makes it non-competitive, we'll lose that innovation. We talked about this when we were referring to medical devices. It's the reality of our system, and that is the combination of a system that is over-coordinated, it's too centralized from a budget point of view. So innovation has to be seen as a driver for transformation, as a driver for access to objectives, better health in the broad sense of the term, because that's going to bring down the silos in healthcare, especially medical devices. It means that healthcare is in the day-to-day lives of people. It means that other actors, other stakeholders linked to healthcare professionals are also involved. It's about accompanying patients according to their different lifetimes. And it means preventing better as well. And I'm convinced that it's through innovation that we will come out of this dilemma that we can't solve. But of course, when I see you around this table, I don't know whether we need to continue with act-based remuneration or not, because this has perverse effects. But we won't be able to grasp innovation. The day we know what the visibility is, the day we know what the cursor is for patients, we will have the right kind of remuneration, act-based remuneration, and the right remuneration for professionals. And I think it's through innovation that we can move out of some of the dilemmas into which we have plunged. So there we are. I won't say any more. So these convictions, two paradoxes seen from the outside of our system. My conviction is that today the time has come to try not to have a new parameter-based reform. The idea is to make sure that we are right at the heart. We've got a great opportunity. There are terrible inequalities in the system because sometimes we're too short-sighted. But how we need to give greater responsibility, greater autonomy to local organizations. We need to fight our way back to a long-term approach, and I think we can have a responsible long-term. It's all about responsibility, empowerment, autonomy. It's all about breaking down silos and putting innovation right at the heart of the strategy. These are the four convictions that I wanted to share with you today. Thank you very much. Thank you very much. Perhaps we can spend some time on the terrace for those who would like to. Thank you to all of the speakers. Thank you to our partners. Thank you to the technical teams, and long live CHAM 2017.